Hello guys, this video is just a guide on how to do our admission history and system assessment in Cerner. First of all, we will receive a phone call from our site manager that there would be an admission from ED, a 19-year-old male patient for ICU with complaints of difficulty of breathing. So you will just ask the ED staff what to prepare and everything. Then once the patient comes in our unit, first, if the patient is conscious, you can just assist the patient towards his room, on his bed, and orientate the patient on his surroundings, how to use the call bell, the get well system, where's the washroom, and you need to, of course, attach him to the monitor, explain why is it necessary, and do our health assessments as well as history taking. So usually I'm getting a paper and do my assessments, or sometimes I'll just take on the cow inside the patient's room. So I'm taking the chief complaint, important height and weight, history, the medical history, the surgical, the family history, social history, the religion of the patient, if there is any allergies to any medicines or any drugs. So once the patient is admitted in Cerner, in our system, if the patient is for ICU admission, it will be on fourth floor adult ICU, and if it's for CCU admission or HDU, it will be in fourth floor critical care high dependency unit. So since our patient, a test patient, is in 424, we will just use this. So patient is admitted in 424, patient test comes, so we will just click on the patient's name, and let's document the admission history and system assessment, where we can find it in ad hoc. So admission, transfer, discharge, just click on it. And then you can see admission history and system assessment adult. Tick the box, and let's start by charting documentation. Chief complaint, patient's difficulty of breathing. Admitted from ED on a wheelchair, accompanied by self, information given by the patient, preferred verbal communication in English, no sensory deficits, no use of contact lenses, glasses, or hearing aids, and pregnancy status, patient is male, so not applicable. Measurements, that's why we need to have this assessment first, because we don't want to get back and forth again and again to open and close the system. So weight is 70 kilogram and height is 173, so it will calculate the BMI for you. Allergies, since this is not the first video, I have put no known allergies. If you want to add more, you can add more, and then mark all as reviewed, so it will show it in the system that you have marked on this day and on this time. Problem history, usually it is from the ED staff or ED doctor, so I'll just mark all as reviewed, and I will just proceed to the next step, which is the past medical history. I have placed the hypertension a while ago, but if patient has diabetes, for example, let's just add diabetes. And then click on the binoculars to search. And let's say diabetes here. Okay. And then if you have, like, for example, he has dyslipidemia, hypothyroidism, you can OK and add new, or just OK. It will show here diabetes. It's better if you know the age at onset, onset date, age at resolve, and everything. All as reviewed. Procedure history. I just placed appendectomy. If patient has any other procedures, just put it here and then mark all as reviewed. Family history, place it as well. Diabetes and hypertension. For example, father has diabetes as well, so you just add and diabetes here. Add, click OK. So father has hypertension and diabetes, mother has diabetes. Mark all as reviewed. Let's go to social history. I just placed tobacco because he's never smoker, so use never smoker. Okay. Alcohol, he's been drinking beer but occasional, so a current user, beer, and it's occasional use. Click OK. Mark as reviewed. Medication history, usually the doctors are putting, the ED doctors are putting, if they have the history assessments already, they will put what are the medicines the patient has taken. And then let's go to the neurological assessment. I'll just click on it because I know that you have taken it already. Symmetric, clear, Glasgow Coma Scale, pupil, yes, regular, okay, regular, okay, reaction to light, brisk, brisk, size, 3, versions, and yeah, abnormal movement, nothing. Cardiovascular, regular, normal, no edema, no anti-embolic devices. So if pulses are all within normal or bounding or weak, just click on this one and it will come together, all together. S1 and S2, no clubbing present, capillary field time less. All the pulses again normal, all the pulses, central pulses normal. And then that's it for me. Respiratory patient is having difficulty breathing. Let's say labor breathing. It's just for example, and then tachypnea. Let's say fine crackles, cough, there's none. Sputum, there's none. Sputum color, none. No. Let's say there is fine crackles here, fine crackles here, clear here, clear here, clear here. Let's go back. Musculoskeletal, none. No use of ambulatory devices, no orthopedic devices, independent, no change from baseline. No, go down. Gastrointestinal, no abdominal pain, normal, present. So color brown, soft, yes. Gastrointestinal details. Soft, non-tender, no abdominal mass. I haven't checked the abdominal girth. Bowel sounds are all present. Messes no, ostomy no, stoma no. Just go back. Genital urinary. No symptoms. Urine color is amber. No bladder distension. Odorless. That's it. Integumentary. Nil. Pink. Moist and intact mucous membrane. Skin temperature is warm. Skin color is normal for ethnicity. Skin description is moist. Then elastic, intact. That's it. Braden scale. This is for example only. No impairment, walks frequently, adequate nutrition, rarely moist, no limitation, no apparent problem. Must. So this one, patient has high blood pressure. Let's put high blood pressure. And other as well, he's having diabetes mellitus or newly diagnosed. Oh, poorly controlled diabetes. Let's say poorly controlled diabetes. Unplanned weight loss, no. Usual weight is 70. So BMI score of because BMI is 23, so greater than 20 is 0. Weight loss is 0, so it should be less than 5. Then 0. Even though the MUS score is 0, but the patient has poorly controlled diabetes and high blood pressure, then we should inform the physician. And let's say Dr. Sudeep. If you can find it, go to the first name, Sudeep. Search Dr. Sudeep. For example, psychosocial, effective coping, stressors, maybe the hospitalization and the diagnosis and the condition. Emotional support, yes. Domestic concern, none. Concerns family members at home, no. Financial concerns, you're gonna have no because he has insurance. Do you receive? Yes. Patient is Catholic. let's see, Catholic. Gender preference for no. Functional assessment, no sensory deficits. History of falls, none. Ability to move bed prior to independent. Ability to ambulate prior to admission independent. ADLs independent. No change from baseline. After discharge, you need no. Morse fall, no history, presence of secondary dose, yes. No. Yes, they did an ED. Normal, oriented on. It will have its own Morse fall risk score. Falls prevention, just have to do what are the preventions for falls. This is for example for our video will be learning needs. Patient is able to read and write, graduate in college, yes from ED. So you need to assess the communication, of course, infection control, lifestyle changes, yes you can. Medication use, of course there are medications that will be given to the patient, equipment like the monitor, nutrition for his diet, pain and pain management if patient has pain, plan of care, safety, self-care, that's it. Learning preference, verbal communication, and video. Let's go for Get Well Network. Did you understand the information? Yes, because we are competent. We are a good teacher. Patient family educator provider, you are the one. You need to educate about the ambulation, condition awareness, exercise program, fall prevention, hand washing of course, infection control if necessary, isolation, precaution, of course medication administration, important, nutrition is important, pain management is important, the plan of care is important, room orientation, he's not smoking so I will not click on it, carry, that's it. Individuals taught our patient, no barriers to learning, patient able to understand everything. Non-evident teaching method, I will go demonstration for deep breathing exercises, explanation, as well as I will go for Get Well Network. And verbalized understanding. Order details, isolation, let's say even though he's in 424 but no isolation because it's just a test patient. IV yes, oxygen yes, he needs oxygen, no blood test. And transport mode is on wheelchair. Valuables and belonging, usually I leave it as blank. Before clicking, most important thing as well, or is an important thing as well, before clicking it, make sure that the patient has, or this document has been done within the 4 hours of patient admission in your unit. So if the patient is admitted in 3 in the morning, 4:05 is fine. So I'll just put on 3:30 on the 23rd and then click on it. And you will see it under your documentation. It is here, admission history and system assessment adult, as well as you can check on form browser as well. It's here. Apart from that, we should also do during patient admission is the discharge planning, and it will be seen as in ad hoc as well. Admission, discharge planning, assessment, then you do the documentation. Just click and check on everything and then click on the green check. That's it.